Good morning. My name is Maria Grazia Spurio. I'm a psychotherapist and I'm happy to present my work, Neuroanatomy of Mourning and Pain, the new psychotherapeutic frontiers to face suffering. The importance of knowing the neuroanatomy of the areas and brain circuits that are activated in case of severe human suffering, such as the affliction for a bereavement or a fear or situation like the ones linked to the COVID-19 pandemic. It is of fundamental importance for all the professionals operating in the biopsychosocial health and wellness sector. Psychologists, psychotherapists, psychiatrists are called to improve specific skills in order to apply a therapeutic intervention able to face a situation of discomfort and aims at overcoming it towards a situation of mental balance, using different interventions in order to activate the same areas of the brain circuits of pain, but with naturally restorative changes. Most of which are still being developed and published, show that in the situation of loss and distress we are facing, it would seem that age and gender have a particular importance with respect to the impacts that such events have for implementation of resilience actions. As far as children are concerned, it is evident that having not yet had the opportunity to develop a capacity to cope with difficulties in a functional way, they present a situation of greater vulnerability, also taking into account the fact that the plasticity of some brain areas and the development of new synaptic connections reaches its peak during the periods of childhood. In the stages of adult life, on the other hand, in the case of the female world, the problem of adequate coping with disabling situations of illness or stress is even more important than in the male world. In fact, society entrusts the female world with greater contemporaneity in the assignments of different roles and tasks. Consequently, the impairment in terms of health of the brain areas involved is more disabling in the various tasks and functions. The words used wisely in therapy, as in the case of inductive words, causes in the anatomical field functional changes aimed at healing, just as pain, fear, and suffering have activated the changes that have caused discomfort, pain, or in the most important cases, depression, post-traumatic stress, or severe pathological situations. Several neuroimaging studies with magnetic functional resonance have been conducted on a group of people with PTSD, post-traumatic stress disorder, versus the control groups of healthy volunteers, and also metabolic studies of nuclear medicine on people with PTSD, in which alteration of the hippocampus with reduction of its volume in people with PTSD. In these studies, alterations of the hippocampus with reduction of its volume have been found in different groups of people with PTSD. For example, veterans of wars, women sexually abused for a long time, or victims of physical and psychological abuse, like, for example, children. Neuroimaging studies using proton magnetic resonance spectroscopy, a method for evaluating the metabolism of brain regions in vivo, have demonstrated a reduction in levels of N-acetylaspartate, a marker of neuronal integrity, in hippocampus of adult patients with PTSD. The limbic zones consist of a grouping of strongly interconnected nervous structures and areas, which reside under the cerebral cortex. The subcortical component of the brain, including the amygdala, which manages emotions and especially fear, is activated when dangerous or unknown and uncontrolled situations are intensely experienced by someone. For example, as happens in the television series Gotham, created by Bruno Heller, when dangerous deviant people use a particular chemical substance called fear drug to control and manipulate the recipients of the criminal act. In reality, something similar happens in a situation of great loss, suffering, or danger, in which some kind of natural drug is released into the body. These are neurotransmitters such as norepinephrine, adrenaline, dopamine, acetylcholine. The various productions of these hormones and substances produce different levels of fear. How is the antidote to the prolonged effect of dysfunctional reactions produced? Some therapeutic techniques have the goal to bring alight fears and sufferings that are often not aware or verbalized, bringing them back to a level of awareness through the creation of new synaptic connection paths, the result of which is a release of chemicals such as endorphins, with analgesic properties that limits and inhibits the perception of pain. In conclusion, we can affirm that the professional's greater sensitivity with respect to brain skills and the development of adequate therapies allows a greater and more effective capacity for intervention. Thanks to the appropriate psychotherapeutic work, the change is optimized by passing from the primitive limbic areas to the areas of the prefrontal cortex, the most evolved and refined brain system. The amygdala also works in synergy with the hippocampus and generates emotional memories that are often not verbalized, but associated with emotions and perceptions. Therefore, it is of fundamental importance to recognize the primary role of these brain areas in successfully dealing with situations of trauma or distress. The use of art, fiction, guided fantasies, creation of green spaces allows an inductive and creative language particularly suitable in the world of childhood and the female universe, where well-being is closely linked to the need to express a sensitivity often shattered by affective reality and its consequences. Both through the re-emergence of negative emotions connected to loss and to their subsequent processing in the therapeutic fields, and as an impact in improving the patient's personal life. This certainly represents a goal for scholars, researchers, psychotherapists who have taken up the ethical and scientific challenge of helping people, women and children first, hit in a new and unexpected way by sufferings, painful changes and losses, to board the lifeboat of psychophysical health. Thank you very much.